Trypanosoma brucei, and cause of human African trypanosomiasis. And firstly, we discuss about African trypanosomiasis, or the next name with disease is trypanosoma. Sleeping sickness. And human African trypanosomiasis or sleeping sickness is a parallel African disease caused by two morphological species of trypanosoma. This trypanosoma, just I show you. That Trypanosoma brucei and Trypanosoma brucei gambis and Trypanosoma brucei rodensis, and transmit to human by tsetse fly. And Trypanosoma brucei, which infected domestic and wild animals, but does not so in human because it is lysed by apoprotein L and lipoprotein fraction of human serum. And if we say about sleeping sickness, this is protozoa disease, one else, and Trypanosoma brucei complex and transmit to human by tsetse fly, and in treated patients with trypanosomiasis, first cause of febrile illness, which is followed months or years later by progressive neurological impairment and death. And parasites east. And the East African and West African forms of sleeping sickness are caused respective by two trypanosoma. Now we said that. And these subspecies are morphologically diagnostic, but cause illness with epidemiological and clinical gesture. And when parasites transmit by blood, second tsetse flies, and of a genus of Glossina. The insects acquired the infections when they inject blood from infected mammals host after many cycles of multiplications in the digest of vectors, and the parasites migrate to the salivary glands, where transmission taking place when the inoculation into a mammals host during subsequent blood meals. And the injection trypanosomiasis multiplying the blood and our extracellular spaces and evade immune destruction for long period by undergoing antigenous variants and for very long period by undergoing antigenic variants, a process driven by gene switching in which the antigenic structure of the organism surface coat of glycoprotein change periodically. And it's a slide. And the next, this is if you say about pathogenesis and pathology, self-limited inflammatory lesions may appear a week or so after the bite at the infected tsetse fly. And for example, on this slide, you can see Trypanosoma brucei in red blood, not human red blood. And then the parasite is through to the form that multiplies in mammal's host. And if you say about systemic febrile illness, when evolved, the parasites are disseminated through the lymphatic and bloodstream. And systemic human African trypanosomiasis without central nervous system involvement in generally referred to as stage first disease. In this stage, one of the pictures now, and in this stage, the widespread lymphadenopathy and splenomegaly reflect make it lymphocytic and histiocytes proliferation and invasion on moral cells, which are plasmacytes that may be involved in the production of immunoglobulin M. And with perivascular infiltration of both parasites and lymphocytes may develop in lymph nodes and the spleen. And hematological manifestation that accompany stage 1 human African trypanosomiasis include moderate leukocytosis, thrombocytopenia, and anemia. High level of immunoglobulins consist primarily of polyclonal immunoglobulin M and condensed future and heterophile antibodies and antibodies to DNA and rheumatological factors are often detected. High levels of antigen antibiotics complex may play a role in the tissue damage and increased vascular permeability that facilitate dissemination of parasites. And stage 2 disease involve invasion of the central nervous system, presence of trypanosomes in perivascular area is accompanied by intense infiltration of mononuclear cells. And what to say about life cycle of trypanosomiasis? Parasites with a two-host life cycle in mammals and arthropods. And the life cycles that when the trypanosoma are ingested during and blood meal by the tsetse fly form on human reservoir in the West African trypanosomiasis, or an animal's reserve in the East African form, and the trypanosomes multiply over periods of 2-3 weeks in the fly market when, and the trypanosomes migrate to the cellular gland where they develop into epimastogotes. and metacyclic trypanosomiasis infected human. What you can see in this picture. Yeah, we can see two cycles. Yeah, two cycles, two parts of one big cycle. Yeah, of during in the way life cycle of members of Trypanosoma complex and between the mammal's bloodstream and several species of flies of the genus Glossa. And when flies bite an infected person or an animal in the course of Trypanosoma brucei, trypanosomes in the bloodstreams can be injected with the blood meal. And in the fly, the infected blood moves to the lumen of the midgut, and where the bloodstream trypanosomes transform during 2 to 3 day period into procyclic stage. And after this period, after 2 to 3 weeks of multiplication in the mild good of the procyclic trypanosomiasis migrate to the salivary glands, where they undergo several additional development changes and culminating in the formation of a natural metacyclic stage. And metacyclic trypanosomiasis reaction of ventricular system. And after that, if we say about fly, the fly injected of metacyclic trypanosomes into the connective tissue of the skin, where a temporary local inflammation called a change of often develops. From this initial portal of entry, the parasites enter the draining lymphatics and pass into bloodstreams through the thoracic duct. They begin to multiply again by binary fusion of transform back into the bloodstream form. And after that, life cycle may continue once more and once more. There is present some forms of trypanosome metacyclic, trypanomastigotes, and different forms of that present in human body and present in tsetse fly. One else, not very good picture, no? About life cycle too. And let me say about the pathophysiology of trypanosomiasis. And if we say about spreading down, we say that this form of trypanosomiasis usually spread only in Africa. And if we say about clinical cause, the painful trypanosomal change, clinical cause of again. Just one moment. And what system involved? And painful trypanosomal chancre appeared in some patients at the site of inoculation of a parasite. And hematogenous and lymphatic dissemination, when we say that with stage 1, is made by the onset of fever. Typically, bouts of high temperature lasting several days are separated by a febrile period. Lymphadenopathy is prominent in trypanosoma brucei and trypanosomiasis. Cervical nodes are often visible, and enlargement of the nodes of the posterior cervical transition of or Van sign is a classic finding, and pruriens and maculopapular rash are common, and incontinent finding including malaise, headache, arthralgia, weight loss, edema, hepatosplenomegaly, and tachycardia. The different diagnostic of stage 1 human African trypanosomiasis include many diseases that are common in the tropical and are associated with fever. HIV infections, malaria, and typhoid fever are common in the population at risk for human African trypanosomiasis and need to be considered. And a central nervous system invasion usually is processed in stage number 2 of disease is characterized by the incidence development of protein neurological manifestation, which are accompanied by progressive abnormalities of in that central nervous system, and progressive identifies and daytime somnolence develops. And in this period, we understand the central nervous system engage in pathological process, and sometimes alternate with restlessness and insomnia at night. And this less gaze accompanies the loss of spontaneously, and speech may become halting and indistinct. And ataxia is frequent, and the patient may appear to have Parkinson's disease with shuffling height, hypertonia, and tremor. In the final phase, progressive neurological impairment ends in coma and death. And understand them and change, usually change the and we spread. I say about slide down where my spread we all say. And some we all discuss about it, the African trypanosomiasis. Not clinical picture, да, sorry, okay. Late some slide. Clinical, да, presentation we discuss what the stage 1 and ELSA, this stage, yeah, and what clinical, the picture ELSA maybe in first stage, this is facial edema, transmitted urticaria rash, the trypanic, it may be different, And stage 2, insomnia, the main, when in which central nervous system and all process. Yeah, and depression, maybe headache, maybe loss of appetite. Just all signs of intoxication, may say, and involve in pathological process central nervous system. Так, okay. And diagnostic. Definitive diagnosis of human African trypanosomiasis requires detection of a parasite. In the chancre is present fluid. Fluid should be expressed and examined directly by light microscopy for the highly motile trypanosomes. And material obtained by needs aspiration of lymph nodes early in the illness should be examined similarly. And the likelihood of finding parasite in blood in high in stage number 1, but in stage number 2 disease, and it in patient infected with Trypanosoma brucei may also be seen in materials aspirated from the bone marrow, and the aspirated can be inoculated into liquid culture medium, as can blood, buffy-coat, lymph nodes aspirated, and cerebrospinal fluid maybe too. It is essential to examine cerebrospinal fluid from all patients in human African trypanosomiasis is suspected, and abnormalities in the cerebrospinal fluid that may be associated with stage number 2 disease, including an increase in the cerebrospinal fluid's mononuclear cells count, as well as increase in opening pressure and in levels of total protein, and else maybe immunoglobulin M. And in our world, therefore, reveal immunoglobulin M, what methods usually used? Ferment analysis, usually used, and microscopic examination too. Note, is a patient with sleeping sickness, insomnia, depression. No, and we say the immunoglobulin M maybe in different body fluids may be revealed, and usually used this method. Lymph nodes aspiration very often, and so on. And if you say the drugs used for treatment human African trypanosomiasis are usually used suramine, pentamine, eflornithine, and usually therapy for human African trypanosomiasis must be individualized on the basis of infection subspecies, the presence of absent of central nervous system disease, adverse reaction, and associated drugs resistant. And usually, сейчас, one moment, что такое? Это мы видели с вами. Мгм. And the serological test, culture maybe test, да, let's say, and treatment, да, usually. And else, Suramine is highly effective against stage number 1, East African disease, or it can cause serious adverse effect and must be administered under the close supervision of a physical. And the drugs is given by slow infusion of freshly prepared 10% aqueous solution, and maybe present some fatal reaction as maybe development nausea, vomiting, shock, seizures, less severe reaction, including fever, photophobia, and renal damage in the most common important adverse effect of suramine. And else may be used milasoprol 2 may be used in what stage that when using may used when in pathological process involves central nervous system, and usually present some side effects too. And one else drug uses eflornithine, eflornithine is highly effective for treatment of both stages of West African trypanosomiasis and African trypanosomiasis, and recommended treatment schedule is 14 milligram per kilogram per day given intravenously in 4 divided dose for 2 weeks, and adverse reaction including diarrhea, anemia, thrombocytopenia, seizures, and hearing loss. And one else is pentamidine, usually used for treatment first stage, first line drugs for patient with stage first West African trypanosomiasis. Dose for both adult and children is 4 milligram kilogram per day, given intramuscular or intravenously for 10 days. Yeah, immediately adverse reaction including nausea, vomiting, tachycardia, and hypertension. And this reaction is usually transient and not very suspicious of therapy. Our adverse reaction including nephrotoxicity, abdominal liver function test, neutropenia, rashes maybe, and if you say that about milasoprol is the drugs of choice for treatment East African trypanosomiasis. This drug current both stage of African disease, and Miller cerebral cars both stage of disease. Patients who fail to respond to or cannot tolerate sulramine or pentamidine. Because of its relatively high toxicity, this drug is never the first choice for the treatment of stage 4 disease. And for African disease, the drugs should be given to adults with 3 courses of 3 days each. And if you say about prevention, and combination usually therapy that may be present. And if you say about prevention, to talk about drugs, monospirine. And if you say about prevention, eradication of factors and drugs treatment on infected human. Individuals can reduce the risk of acquiring trypanosomiasis by avoiding area known to have infected insects, by wearing protective clothing, and by using insect repellents. And in some cases, if you say about specific prophylactic absence, but maybe say about hemoprophylactic, which too not is not recommended to, and vaccination absent. In other words, only non-specific prophylactic may be used. Okay, and the next, this is American trypanosomiasis. I think very quickly we discuss. The next name with disease is Chagas disease. And Chagas disease or American trypanosomiasis is zoonotic. Zoonosis caused by protozoa parasites Trypanosoma cruzi. Acute Chagas disease is usually a mild febrile illness that results from initial infections which were organism. After spontaneous resolutions of acute illness, most infected person remained for life in the indeterminate phase of chronic Chagas disease, which is characterized by subparent parasitemia, easily detectable antibodies to Trypanosoma cruzi, and as an absence of symptoms. In a minority of chronically infected patient, cardiac and gastrointestinal lesion develop that can result in serious morbidity and even death. And if you say about epidemiology, the spread usually by name the American trypanosomiasis because spread in Mexico, Central America, and South America usually spread this disease. And if you say about life cycle with disease, life cycle is indurating inflammatory life cycle of Trypanosoma cruzi is transmitted among its mammals caused by gematophagous triatomine insects, often called Lidovin bugs. And the insects become infected by second blood from animals or humans who have circulating parasites. Ingested organisms multiply in the gut of the trypanosomes, and infected forms are exchanged with feces at the time of subsequent blood meals. And transmission to a second vertebrate host occurring with a break in the skin, mucous membrane, or becomes contaminated with bag, feces that contain infected parasites. And a trypanosoma cruzi can also be transmitted by the transfusion of blood donated by infected person, by organ transplantation from mouse to fetus, and in laboratory accidents. And we say that may transmit bags and maybe two life cycle may be divided two main group, the two main part, human stage and back stage. And as trypanosoma brucei too, that maybe see different part of trypanosoma and indurated inflammatory lesion called by chagoma. I'll show you my back. Yeah. Not very big, only 20 millimeters, and Chagas disease may be acute and chronic phase. And indurated inflammatory lesion called chagoma often appears at the parasite portal of entry, and local histological changes, including the presence of parasites within leukocytes and cells of subcutaneous tissue, and the development of intestinal edema, lymphocytic infiltration, and reactive hyperplasia of adjacent lymph nodes. After dissemination of the organism through the lymphatic and the bloodstream, muscles, including myocarditis, may become healthy parasitosis. And in the minority of persons with chronic trypanosoma cruzi infection who develop relative clinical manifestation, the heart in the organ most commonly